Hi guys, my name is Sanjay Gupta. I am a consultant cardiologist and I work in York. And at present I am in Rome attending the European Society of Cardiology Congress. And I wanted to share something with you which was particularly interesting to me, and it relates to the subject of atrial fibrillation. Okay, atrial fibrillation is an extremely common heart rhythm disorder. And a lot of people who watch my blog suffer from atrial fibrillation. And to most people, atrial fibrillation is atrial fibrillation. Atrial fibrillation is considered a diagnosis, and for a large part of my practice, I've just treated atrial fibrillation as atrial fibrillation, recognizing it to be one disease. However, I'm hoping that today I'll be able to convince you that we're doing nothing by thinking of it as one disease. And perhaps it's more complex than that. The reason is this. When you look at a population of atrial fibrillation patients, and if you just look at all these people, they fall in different groups. Some people tolerate atrial fibrillation relatively well, others don't tolerate it well at all. Some people seem to do really well with an ablation, other people don't do well with ablation. Some people just get atrial fibrillation, in others it becomes permanent very quickly. So what we have started realizing, or what we have realized for a long time, is that there's a very heterogeneous group of patients. It's not all patients are the same who suffer from atrial fibrillation, and different people are more troubled, are more or less troubled than others when they have atrial fibrillation. So the same conditions to be causing seems to be behaving differently in different groups of patients. Now, and what is very interesting is this, and I was fortunate enough today to see Professor Gersh, who's a real legend in terms of atrial fibrillation work, and Professor Gersh was lecturing, and it was an amazing lecture. So what he was telling us was this, that a few years ago they did a study, okay, and it was a study where they looked at patients with atrial fibrillation in the community. The mean age of this population was about 73 years, and these were all comers, patients who had hypertension, diabetes, etc. And when they followed them up, they found that there was a substantially, these are patients who were not necessarily anticoagulated for their atrial fibrillation. They found that there was a substantially higher mortality in these patients, and a significant number of people subsequently, unfortunately, succumbed either to strokes or heart attacks, etc. Okay. They then did another study where they took patients who had just atrial fibrillation, who were under the age of 65, and who had no other risk factors, who didn't have diabetes, who didn't have high blood pressure. These people are called these patients are called lone AF sufferers, okay? People who have no other risk factors, who just have AFib, nothing else. They're called lone AFib. So they then studied this group of patients who had lone AFib with no risk factors, and they followed them up. And they found that in this group, the stroke risk was incredibly low. It was the same as the normal population. So it became very interesting that if you have the same condition, yet two populations who suffer from the same condition behave in totally different ways. People who were in heart failure, etc., seem to have a much poorer prognosis in the long run compared to those patients who had lone atrial fibrillation with no risk factors and who were generally younger. And what we are now beginning to realize is that maybe AFib consists of two diseases. Okay, maybe AFib is a disease, but also a symptom. Now, let me try and explain this. There are a group of patients, okay, who get AFib, who are young, who have no other exacerbating risk factor, who have these people who have low atrial fibrillation, okay? And in those patients, the AF is the disease because they don't have anything else, and maybe they have a disordered vagal tone, maybe they have something wrong with their autonomic nervous system, their vagal tone may be extremely high, or they may be particularly vulnerable to certain triggers like alcohol, coffee, that kind of thing. And these people have AFib, the disease, and generally these people are young. They seem to tolerate their AFib very badly. The AFib is usually paroxysmal, meaning that it comes and goes. And actually, interestingly, these are the patients who do extremely well with an ablation, all right? And then there's the other group of patients in whom AFib is probably a symptom rather than a disease. And it is a symptom of other diseases affecting the heart. So diabetes, high blood pressure, heart failure, sleep apnea, okay? And even high endurance exercise. These are, so the AFib here is a symptom which is representing the effect of all these conditions on the heart, all right? And these are patients who tolerate their AFib a lot better, but the AFib is more likely to be permanent, and these are the patients who don't do so well with things like an ablation, and therefore they require a lot more attempts at ablation, and in those people, the risk of stroke is much higher. So if we start thinking of atrial fibrillation as two separate diseases, we start understanding how best to treat those patients, i.e. those patients who have low AFib, normal-sized atria, who have very troublesome symptoms, but actually their prognosis is very good. In those patients, an ablation is probably a really good option. In those patients who have other conditions causing their AFib, the AFib is probably just a symptom of these other conditions. And in those patients, it is incredibly important to treat the underlying condition. So aggressive treatment of high blood pressure, aggressive treatment of diabetes, aggressive treatment of sleep apnea, etc. And this is something which is really interesting to me, because until now I'd always thought of AFib as just one thing, but now we're beginning to realize that maybe, it's not just a disease. There's probably a disease in those people who have no other risk factors, and it probably is a symptom in those people who have lots of risk factors, and therefore the AFib is a manifestation of those symptoms, particularly things like high blood pressure. So I hope this was useful. It just starts, hopefully this just tells you how we're now beginning to start thinking about AFib, and this will then allow, thinking like this about AFib will then allow people to get more appropriate treatment for their AFib, and therefore you're identifying those people who will do really well with things like an ablation, and perhaps those who may not necessarily have such an ablation. So I hope this was helpful. I've done, there's quite a lot of really interesting stuff at this meeting, so I hope to share it with you as time progresses. My name is Sanjay Gupta. My website is yourcardiology.co.uk. My Facebook page is yourcardiology@gmail.com. Thank you so much for listening, and I wish you good night.